welcome to the Ripple Effect podcast. I'm Lindsay McNally, your host, and Champ Jones is your co host. Our special guest is Dr. Georgia Heise. She is the Public Health Director at Three Rivers District Health Department in Kentucky. Georgia from Kentucky, welcome.
Thank you.
Today, we're going to ask a few questions about public health and your legacy here at Three Rivers District Health Department. So let's get right in. So, do you like to be called Dr. Heise or Miss Georgie or?
Georgia's fine.
Okay. Georgia, what drew you to public health?
It was probably an accident. I was in school, just a child really, but I worked in the ER at UK, and seeing all the things that came in the emergency room that could have been prevented seemed such a problem to me that I wanted to see if I could do upstream work, and I didn't even know that term at the time, but it seemed like, why can't we intervene on all these issues before they become an ER visit or an ER visit that ends in a death or that kind of thing? Because most of the stuff, and anybody still in an emergency room after all these years will tell you most things that come through their doors are very preventable.
How old were you?
Oh, 21, 2.
You were a student at University of Kentucky? So the name of this podcast is The Ripple Effect. In your view, how does a single public health initiative at the local level create a ripple?
Well, people are very social animals, and I think word of mouth, anything, good or bad, travels really quickly, especially in Kentucky and small rural communities. So I would say that is our biggest, even though we have all this podcasts and the cell phones and all that kind of stuff, it's still initiated by a person. So I think people spread their experiences, whether they're good or bad. So I'm still going to go with it's word of mouth.
Nice. Well, looking back at your career, what is a project or a moment that best defines your legacy in Kentucky public health? I could probably guess what it is, but you tell
Looking
us.
back at my career, that makes me feel so old. I don't, in a heartbeat, I went from being the youngest, most inexperienced kid at Three Rivers to now the oldest granny on the block. I'm a Gigi though, not a granny. There have been many defining moments and many memories that I will cherish, and many people that left lasting impressions, both good and not good. I'm going to say that the legislation, and there were a lot of other people involved in that as well, but the legislation that I was a part of that defines now the funding for public health in Kentucky, that was huge. That's probably going to affect more people than anything else. Being the first health department, or one of 7 local health departments in the country accredited, that was, quite the ride and sort of an unexpected accolade or all the hoopla that came with it. That was a good experience. It got me a lot of in touch with people that do these things, podcasts and national kind of stuff. So that was special. But there have been other moments that maybe haven't touched as many people or people don't know about, but watching a person come into the health department and find their calling, so to speak, and have a job they love. There's been a lot of that, and those are they mean a lot to me, a lot more than other, plaques and stuff like that. So I like the interaction I've had with people, helping them find their way.
Yeah, because that will last longer and make a bigger impact than the one big thing that you could have done too. So I can see that. Well, it sounds like you've had a lot of opportunities to change not just employees' lives, but your community too. So what do you hope for the Three Rivers District Health Department culture? What do you want it to look like after you have left? So after your direct leadership role has transitioned, what do you want the culture here to look like?
Well, I love it the way it is right now. It's not always been this. It's not always been fun. There have been times when we've had no resources that was very difficult. Excuse me. It's also we've had people that, as a result of not resources, lose their job. That was difficult. But there's so many directions you can go in, like this, doing a podcast. That's not something I saw coming. But we're very inclusive and very open to new ideas, and I really hope that stays. And I would like it to be the culture to be a great place. I said this in my very first strategic plan for Three Rivers. Three Rivers is a great place to work, and I really think it is because we do our absolute best to put people in a position where they can flourish and find their way and help other people and make an impact in the community and that sort of stuff. So I really like that culture, and I like it to be laid back. I don't want people to be ever nervous or feel like you have to be anything other than just who you are at work. I don't like a lot of pomp and circumstance. Just everybody relaxed and do what needs to be done.
Yeah, you certainly set the stage for that, and that's what I hope too. I hope that continues because I have a lot of years left to work in public health or in general before I can leave. So I hope that it stays the same. People often confuse public health with clinic medicine or clinic. I don't want to say clinic because we do have clinic, but more of the medical side. So, how do you describe the invisible work that public health does to keep people healthy before they actually need that hospital visit?
Well, public health has an identity problem, and we've been saying that when I started, and as I'm going out the door, we're still saying it. So that's unfortunate. But I would love it if it could be seen as an infrastructure, the same as our water system, our roadways, our fire department, police department, that it was seen as the infrastructure that people can flourish in versus a fee for service kind of treatment for medical issues. It's easy to confuse the two, but I guess public health is in the eye of the beholder, like, beauty or art or possibly, hopefully not pornography. You know it when you see it. I don't know that people do know it when they see it because public health can be anything that the community needs it to be. In some places, there are a lot of clinical services because the health department's the only access that people have. But it's much easier to not need medical services if you have clean water, plenty of fresh food, if you have access to a job with a living wage and things that just make life livable. If that's available to you, then you're less likely to need the emergency room or the doctor's office as much or in a bad way. You can just do it for, upkeep. Because most people access medical care at a time that's really either like the birth of a baby, really good, or diagnosis of a disease, it's really bad. They remember medical care, and medical care saves your life, and when you have an accident or that kind of thing, so they tend to remember that. And then anything that looks like that to a person, they sort of make it along the lines of the doctor's office. But public health is all about how can we take the resources that we have and make the best life we can for everybody. And it's very broad. So it's in the eye of the beholder. Most people think of public health as what they've dealt with. So if you've been part of the HANDS program, then that's what public health is to you. If you've been in the clinic to get routine vaccinations, then that's what it is. If you are an installer and you depend on the health department to okay your work and that sort of stuff, then that's what you think public health is about. So it's kind of what your experience has been.
What are some things that Three Rivers has done in the past and currently does to help sort of educate their communities on what their health department is up to?
Well, hopefully, what we're doing right here is going to be helpful. But we have a huge social media presence. We have a lot of that advertising in many different ways, not just the social media, but everything that's out there. We spend a lot of time out in the community, and we have our vehicles have logos and messages and things on them, but we're do a lot of programs with young people and the schools, and so we try to be wherever we can be that we can make an impact and also let people know other things that we have to offer.
So visibility.
Yes.
So for those who are entering a public health workforce, what is a piece of advice that you would give a young whippersnapper right out of college going into public health that might be gung-ho, but you give them some good solid life advice?
Well, public health is what you make it as an employee. So you could experience an employer trying to put you in a box. Don't let that happen, because public health extends beyond any boxes, boundaries, county lines, even countries. It's we're on this planet together. None of us are going to get off of it alive. So we're should be thoughtful of what is going on around us. Find your niche and go with that. Build it into what you want it to be. It's a great place to find work that you love. It's not necessarily a great place to find a lot of money. So if that is your goal, think carefully about whether or not you want to go into public health. That being said, there are some ways to make, money in public health, but I would think of it as looking for work that's meaningful, and you're always going to do better if you are doing something that you like. And I think life is pretty short, and looking backwards, it's really short. Looking forward, it might seem long, but go for something that means a lot to you, makes you feel good at the end of the day, even the days that are aggravating and wear you out. And there are some of those in public health. But there are others that just make your heart warm, and, go for that.
It's good advice. One thing that you want residents or community members to know about their local health department?
Well, come and get to know us. So if you haven't seen us somewhere, you haven't seen our van, if you haven't met Champ, like you mentioned earlier, come and see us at the health department, because there's a lot of good people, and that's all over the state and all over the country. People go into public health, maybe some of them accidentally, but nobody stays in public health unless they really want to make a difference and find the work that they love. So we will have something for you. Come and see us, and there will be a project, a service, something that will be there that anybody can find that works for them. So come see us.
That's your call to action. Come see us. Come find out. If you don't know, if you think you do know, knock on the door or come right in. One last question. The Three Rivers District Health Department's motto is all one team. Can you explain what that means, all one team?
Well, I think it means that, like I said earlier, we are all on this planet together. So all one team. It could be your department at the health department, the hands department, the environmental department. It could be all of us, Three Rivers. We're all one team. It could be our counties. We're all one team. Our district, our state, Kentucky, we're all one team. And you don't escape that. We are all one team, even everybody on the planet. We are in it together. There is no, this is just working for me and I'm not affecting anybody else. We all are affecting each other. So there's a big meaning to the all one team.
Yeah. So helping each other out and always looking out for one another, because what we do affects everybody. So all one team. Okay, well, that is the end of this episode. Is there anything else that you want to add to this? very first episode that we have for the ripple effect?
Well, I want you to meet Champ. Champ, you want to get up here? So Champ is an example. He's an employee at Three Rivers. He's an example of how public health can be something to everyone, because he comes and makes people that are uncomfortable feel comfortable, and he makes employees who are having a hard day have a smile. So I really appreciate the fact that we are sharing this space with animals, and we're trying our best to take care of everybody, make it a pleasant place. And I want that to continue on for public health. And then if we have any legislators listening, please fully fund the health departments via the statute that we worked really hard to get in place, so that we would not be at risk for layoffs and loss of services and that sort of thing. So I think
if there is a legislator listening that might not even have any idea what you're talking about, what's that? What is that KRS?
You can look at KRS 211.186, and it's exactly how the health departments are to be funded, how to calculate that every budget cycle. So we would really love to see that happen.
Yes. So now, no excuses. Thank you for tuning in to the Ripple Effect podcast. We will see you next week.